absolutely, this is changing by the hour, and we're going to do the best we can to be prompt, and but at the same time, we're going to absolutely, deal with talking with the president, because that's our lifeline in lots of ways. I'm going to go through this pretty quickly, and then I'm going to turn it back on over to the experts. I'll be here to answer your questions. Yesterday, I spoke with the White House 2 different times yesterday. We put up a substantial request for lots and lots and lots of supplies, from ventilators to masks to on and on and on. We're still sourcing them, and you'll hear this from our people. We're sourcing them all over the globe. We have been very fortunate to be able to obtain supplies and keep our head above water. But we also recognize wholeheartedly that our medical and healthcare professionals are out there, and our first responders in every way, and we need to protect them. And we're, my dad was always say, don't confuse effort with accomplishment, but I'll promise you there's massive, massive amounts of effort going in to assure you and to obtain the needed supplies that you're looking for. Now, with all that being said, let me remind you one more time that now's not the time to panic. I've said this many, many, many times. Surely we're going to be cautious, but be smart right now and be strong, and we're going to get through this. I think you'll hear later that our curve is not spiking, but it's surely not exactly where we want it. Last night now we're up to a total of 51 cases as I have it here. We have 20 of the residents that were in that nursing home in the Morgantown area that have now tested positive. It's a great big problem. I mean, there's no question whatsoever. It is the horror story that we absolutely didn't want to have happen, at least from a nursing home standpoint, because that's a place, that our elderly are at for sure. We have 8 staff members at that nursing home that have now tested positive. We're throwing every resource in the world at that situation, and in order to take care of those people, with even the possibility of moving some of those people, moving the ones, that are either are the sick or the well to another facility where that they're taken care of and they're not exposed. I guess there's several different things that I want to talk about here, but the biggest thing that I've got to announce today is, there's lots of stuff, but one of the most significant things is just this. Dr. Clay Marsh he's been with us from day one, and he's worked, hand in hand with Kathy Slimp and with Secretary Crouch and with all of us, and with our General Hoyer and all of us. Well, just for, from the standpoint of taking this one step further, we have solicited WVU to give him to us on loan. I mean, he said to me the other night, he said, I keep showing up in all these pictures. Of course, everybody can't see the work that he's doing behind the doors and everything, but I keep showing up in all these pictures, and I almost feel like Forrest Gump, to tell you the truth. And I thought, really, at the end of the day, he has done an incredible job. We got approval from WVU last night to have him on loan, and I am making him right now our COVID-19 czar, or a coronavirus czar. And he's going to work hand in hand with Secretary Crouch and Kathy and all the people here and everything. But it gives us one more layer of expertise and one more layer of an affiliation with hospital and knowledge, and it gives us one more layer to give the great people like Kathy and everything the ability for us to not. We can get so focused on this coronavirus and everything, or coronavirus, but that we can absolutely then lose a lot of attention that we should have on just the medical wellness of our whole population. And so So there's so many different aspects, but I'm really pleased, that Clay's going to come on board, and I appreciate, I thank WVU. I thank, our great president, Gordon Gee, and I thank him for giving us to Clay at this time on loan, and so welcome aboard. And I haven't had the opportunity to make somebody a czar yet, but making Clay Marsh a czar, I mean, it's just appropriate. That's all I can say. Now, from the stimulus package, and I want to report just a second on that, and this is kind of tied, we've got Secretary Gonch over here, and it's kind of tied to our Department of Commerce and Workforce West Virginia, and they've stepped up unbelievable. They're processing all these unbelievable amount of claims, workers' comp claims, and I thank Secretary Gonch, more than you'll know, but I want to just say this, and I've said this over and over and over. We need to be dialed in first and foremost to the wellness and health of the highest risk state in the nation. That's us. Now, and we're doing that. And we're trying every way to make the right moves on the chessboard to ensure that highest risk state doesn't have an incredible amount of fatalities and the badness that could come and the badness that many people believe is coming. Now, let me just say this. From an economic standpoint, I have said it from day one, that is really in my wheelhouse. But from the standpoint of the business person that I am, without any question, I said the nation and our state will have to step up. They'll have to step up and make us as whole as we possibly can be. Whether you're at home worried about, a paycheck from the standpoint of being able to pay a power bill or being able to go get groceries or whatever like that, I've said it'll be okay. I didn't know how, but I knew it would be okay. Well, last night at almost 12 o'clock, and I'm watching like crazy and everything, and on the phone with everybody coming or going, the Senate passed our stimulus package. It's going to go to the House tomorrow morning. I really feel like that it will be passed, and it will be passed very quickly. It's trillions and trillions and trillions of dollars that none of us can possibly imagine. We're just on the video conference with the president. There's going to be an incredible amount of dollars that are going to flow to West Virginia. God bless him and God bless our nation. And with that all said and everything, there's going to be many, many, many opportunities for our small businesses, provided that they continue to employ our workers. And so from the standpoint of you as a worker, and today, I do not urge you to come to work in any way, shape, form, or fashion. I'm saying for you to stay home. Stay home, and our businesses, please let our people work from home as long as this terrible health situation is with us. But in the days to come, and this is not going to move like government has moved in the past, like a snail. This is moving at light speed. And I absolutely believe that next week, from our business's standpoint, you'll have the ability and the roadmap to be able to get to dollars and maybe take a ton of stress off of you from the standpoint of those businesses being able to survive. And from the standpoint of our workers and everything, there'll be goodness right around the corner. Now, I can't promise it will make every single one of us whole, but in lots of ways, it will make every single one of us even better. From the standpoint of making you whole from a paycheck, but in addition to that, the government is going to be sending you dollars. I think it's $1,200 per adult and $500 for children within your home. And they're going to be doing that in addition to the payments, as I understand it, that are already coming your way. So don't hold me to every specific, because we don't have all the specifics yet, but I can tell you that I think at least everything's going to be good there. Now, I guess the last thing I've got to report, let me just make sure, what Well, I do want to touch on this. You know, from the standpoint of our mental health workers and from the standpoint of all those that are having trouble, you know, with addiction or treatment services that are needed in every way, please understand that we're on this and we recognize this crisis, and absolutely we want you to continue to get treatment, and we're working that, and you'll hear more about that from our medical community, but that's not something we're ignoring. And the other thing I want to say is just this. You know, there's a fellow that I see all the time, and he works, he cleans here in lots of different ways in the Capitol, and I just saw him outside yesterday, and he said, don't forget those people that are the homeless. The homeless people, you know, in many ways are still together, and they're hurting, and they don't really know where to turn to, and absolutely I want him to know, and I want everyone to know that we're working that as well. We recognize the situation. We recognize their plight in a lot of cases. You know, it's just people that are down on their luck in lots and lots of ways and know where to turn, you know, and we absolutely need to reach out and take care of them as well. Now, last thing I want to say, and this is really just a shot across the bow, West Virginia is surely looking from the standpoint of a New Yorker, you know, and other places, you know, that across this country that are really having a dilemma. West Virginia looks like a safe haven, a place to come to weather the storm. Now, all I would say is just this. Our president has said over and over and over that if you come from New York to here and I follow suit hand in hand, you need to self-quarantine yourself for 14 days. The same thing is probably true if you're coming from another hot spot in another area of the country. Now, if you owned a home here and you're coming here from New York to a second home, I don't know how in the world we can stop you from coming here. But if you don't abide by the recommendations that have been told to you, then I'm going to try any and every way I can to protect our citizens from a possible transmission that you may bring to us. Now, we welcome all those all the time to this great state of West Virginia, but in this situation, I want our local health officials to be alerted to the fact that these people are supposed to self-quarantine themselves for 14 days. Now, if you self-quarantine for 14 days and you're great and in good shape and everything, we embrace you beyond belief, and we would love for you to just take up full-time residence in West Virginia forever. But you have got to understand that I take it really seriously, that you need to self-quarantine yourself for 14 days. I don't know exactly what I can do, but trust me, I want you to do just that and follow those guidelines. Now, that being said, I really don't have anything else, and I'll turn it over to our people, and you can go through that, Jordan.
Thank you, Governor. Ladies and gentlemen, as part of our briefing today, our friends with the media are once again joining us by teleconference. We'll be taking their questions in just a moment, but first we're going to take comments from a few of our panel members. Up first is Secretary of the West Virginia Department of Commerce, Ed Gaunch.
Thank you, Governor. You've given us direction at the West Virginia Department of Commerce, all hands on deck. You say all the king's horses, all the king's men, and we're there. I'm here today to give a brief report about what's going on there. Commerce recognizes the significance of this situation, first and foremost to the health and well-being of our fellow West Virginia citizens. But we also recognize the economic impact this event is having on our employers and employees in the state of West Virginia. And we're a very diverse organization, but I'd like to just give you a quick update on those agencies most directly involved with this event. First and foremost, Workforce West Virginia is the organization who've been tasked to handle the claims that have been coming in. I can tell you that as of this morning, it was reported to me that we've processed 41,549 initial claims for benefits. That's since your executive order on 319. In addition to that, we've processed over $10,000 low earnings claims. We have about 148 team members doing this. I'd like to provide some phone numbers, some contact info to help our folks get more expeditious handling of their claims. If you go online, that's the best thing to do. uc.workforcewestvirginia.org. It's on your screen now. Or by phone at 800-252-JOBS, 800-252-5627. Or we can email at workforce.COVID-19, workforce.covid19 at westvirginia.gov. Our staff have really done yeoman's work, and I have to say they're heroes to me. We've had no staff issues. We've had volunteers who volunteered to go and provide service to our fellow citizens, and I'm very proud of them. We have had a few systems issues, which I'll mention to you. Sometimes the system just gets overloaded. Our system is interfaced with the federal system, and sometimes we find a bubble. But some more heroes here have been our OT folks here at the state of West Virginia. They've been at our beck and call, and they've been there every time we've needed them. I will tell you that if you file late in the week, it's possible that you won't get your benefits the very next week. That's just the way the system works. But when you do the week after that, both weeks will be on your benefits, whether they're direct deposited or you get a P card or a debit card from the provider. I also want to tell you, Governor, that our other departments, you've talked about the Department of Natural Resources and what's happening there. Our Department of Labor is working a skeleton crew. We're processing license and permit requests so that our people can be ready to go to work when the situation changes. Our mine inspectors are working because our mines are open, because they are an essential business in the state of West Virginia, as well as our state foresters. Now, lastly, I'd like to tell you that other commerce agencies, specifically the West Virginia Development Office, is busy developing plans to assist employees and employers who've been adversely impacted. And we will coordinate with the federal government as soon as we know all of the details of this federal assistance that's going to be available. And we're working to become a clearinghouse for the assistance, whether it's state or federal, that is available for our businesses and employees, and to help folks navigate through the process to obtain those benefits. Governor Justice, as I said, you've directed an all-hands-on-deck approach, and we are doing that. I'm proud of our folks at Commerce. I'd like to end by saying that we will have a functioning website this afternoon, and you can go to westvirginia.gov and access that this afternoon. Or if you're a small business and you have concerns about the benefits available through the SBA, you can go to wvsbdc.com, wvsbdc.com. Thank you, Governor.
Thank you, Secretary Gaunch. Up next, Major General Hoyer with the West Virginia National Guard.
Good afternoon. At this time, there are 160 additional National Guard personnel on duty. I want to highlight a couple of key areas of location support. 19 of those individuals are working across various state agencies and county governments as liaisons, and today 24 additional personnel have been brought on in order to support the information and data analytics support needed to address this threat. In addition to that, under the stabilization efforts, in the last 24 hours, and I would like to, on behalf of Governor Justice and all the members up here, thank the food bank in Gassaway, who in a 24-hour period has prepared 1,073 30-day food meal packs for families. a tremendous effort on the part of our citizens, and again, the governor and this team greatly appreciate the effort in that regard. I also want to point out in that I've talked with Superintendent Birch. For those who might be concerned based on the extension of the school outage, the spring break issues that may come up related to that, Superintendent Birch is working with all the superintendents to assure that our children have food as necessary. Under the logistics piece, I'd like to point out that we have supplied to West Virginia University Hospital 30 of what I refer to as the PAPR systems. Those are the reusable systems that help us reduce the PPE requirements. 30 are going to CAMC today. Others are being distributed as they come in from the manufacturer in Maryland. I would just also like to point out, and the governor's pointed out on several occasions, just so people understand the magnitude of the logistics issue that we're attempting to work. We have made a request for both from the federal government as well as trying to source privately a minimum of 5 million surgical masks, 2.5 million N95 respirators, 30,000 additional extraction kits for the testing, as well as 150,000 transport media sets for that as well. I hope people understand that we are working diligently. The governor presses every day for us to make sure we're working all the sources possible. We have a warehouse system in place that as equipment and supplies come in, it will go out within less than a 24-hour period. Thank you.
Thank you, General Hoyer. Up next, Dr. Clay Marsh in his new role as coronavirus czar.
Well, it's quite an honor to be included with this esteemed group. And I would say for me, I am so appreciative of Governor Justice and having the faith and adding me to the team. Certainly his heart is to help the state of West Virginia, and I am inspired by that. By Secretary Crouch and Commissioner Slemp. I will tell you, from getting a backstage view of what these guys do, they work tirelessly on behalf of the citizens of our state and do an amazing job. General Hoyer, who is a can-do guy, who has can-do people, and I think as a team we are working really well. But this is a big job, and this is an unprecedented time. And I am delighted and greatly appreciative as well of the leadership of West Virginia University, President Gee, who is part of the reason why I'm back here. I'm finding that the other part of the reason why I'm back here is because by coming home, I've been able to heal, and I want to help others stay healthy as well. So I want to say in this new temporary role that I am fulfilling to try to help our state and try to help these great people here at the podium and serve Governor Justice in the state, that I feel that we have a tremendous team. We have great medical schools and great leadership of the schools. We have great hospital system, and the Hospital Association is working diligently with us. We have a great public health and community health group, and Commissioner Slemp is expert at that, and we are incredibly lucky to have her in that role. And we have problems with logistics and with needs that not only do we want to provide our frontline staff with the right personal protective equipment and to reassure them that we will protect them as they protect us, but General Hoyer has a group of people that are both exceptional people, and they're Bill is doing an amazing job in a very, very challenging time. So our job here is to serve you, to make the jobs of the people out there on the front lines, the essential workers, the hospital personnel, the doctors and nurses, but the people working there feel safe and be able to do their job in the best way possible. And I'll say that we will work very hard, put together the right teams, ask the smartest people that we know to work as a unit, to communicate freely and openly, to challenge each other to do the best job we can. To do the best job we can to serve the state of West Virginia and to serve the people doing the work. The good news in the last 24 hours is that although our number of positive tests versus the total number of tests that we did went up over the last few days, it stabilized over the last 24 hours at about 5% of the tests that we did are positive. That is a very good sign that we are doing the right things as a state, and the citizens are staying home and social distancing and washing their hands and not touching their face and helping others do the same thing. We don't know yet if we've absolutely flattened the curve, but we've bought ourselves more time to do the kind of work and preparation that General Hoyer talked about and that I'm sure Secretary Crouch and Commissioner Slimp will. So even though we're doing really well, and I'm really proud of the effort of all of our citizens, and they're coming together as West Virginia does, West Virginia is strong, we can't get complacent, and we know that this is a longer process, and we need to stay together, we need to stay focused, but if we do the right things, I sincerely believe that we can be the model for the rest of the country. Thank you.
Thank you, Dr. Marsh. We apologize for the audio issue. Up next, we have Secretary Bill Crouch with the West Virginia DHHR.
Yes, thank you. Thank you, Governor. I have a few things I want to talk about. We're getting questions on, and we want to try to clear up some of these issues for folks. Our Bureau of Medical Services, our Medicaid agency, is allowing all COVID-19 testing and subsequent treatment for COVID-19 diagnosis as needed without prior approval from our utilization management, which is what is the normal process. Also, all testing and treatment for all uninsured individuals will also be covered by West Virginia Medicaid during this national state of emergency. In terms of telehealth, we get questions about that as well. Our Bureau of Medical Services is allowing non-emergent services to be rendered through telehealth, and that decision also includes doing that with only audio, not necessarily a video. So whatever is necessary to provide telehealth services and medical services, healthcare services through telehealth, we will cover. Behavioral health support, the governor talked about that again. It is critical. He's absolutely right that we have to provide support to folks out there. I talked a little bit about this yesterday in terms of the stress and the difficulty that individuals in West Virginia may be having. Also our healthcare providers, who are the folks that are going to pull us through this crisis. So we have a line called Help for West Virginia, or Help for WV, which is available for everyone, and in which we can respond to questions and refer folks further. The National Suicide Prevention Lifeline is 800-273-TALK, T-A-L-K. That's 1-800-273-TALK, or 8255. The National Disaster Distress Helpline is 1-800-985-5990, or Talk With Us. We have I believe General Hoyer has talked about our 211 helpline. That is a number, if you text or call, either one, on your cell phones, you can get information. I believe that may work on landlines as well. It does, yes. So use that number if you have any questions, and we will have folks there that can help you get to the appropriate number, the appropriate people if you need assistance. Governor also mentioned the homeless. We are working with the providers through Secretary Goncha's office to provide support to the extent that we can through coordinating homeless services in local communities. We're developing guidance to support the local information from HUD and the U.S. Interagency Council, along with CDC guidelines. I'll let Kathy talk about Bureau for Children and Families policies. We approved a new policy yesterday for child care agencies, and we want to talk about that a little bit. I don't think a day goes by that the governor doesn't say, make sure our kids are safe, make sure our families are safe, and that's what we're trying to do here. And if anyone needs assistance, please, there's several ways to get in contact with us, and we're happy to try to do anything and everything we can to assist you.
Thank you, Secretary Crouch. Up next, Dr. Kathy Slimp, our State Health Officer.
Thank you. To speak to a couple of things that came up yesterday, I wanted to follow up on. These are activities through our Bureau of Children and Families. For folks that receive Supplemental Nutrition Assistance Program, SNAP, they have actually put forward 3 waivers that will support folks that receive that. That includes that renewals for customers already receiving SNAP benefits have been already extended for 3 months, so they don't have to do those renewals if they were coming due now. That was approved yesterday. We have applications in for a couple of other ways to expand access to SNAP benefits and food services. That includes applications related to college students, and then also to add supplemental SNAP benefits to our existing SNAP households. Those are ones that we've applied for, but are not yet approved yet federally. And then we're exploring some really kind of novel things through the Department of Education and with DHHR in partnership, and that's to support and provide SNAP benefits to school children in terms of the pandemic SNAP benefits as a special kind of project. So that supplements some of the work, the incredible work that Department of Education and the Guard have been doing together with community partners in getting children fed. Related to child care, DHHR rolled out yesterday the Critical Need Child Care Program, and that is really designed to provide child care for essential workers, as defined by the governor's order. That works to reduce the regulation requirements, but still assure the safety piece and make sure licensing for entities that can provide child care for essential workers. There is an email address for if you want to apply to be a child care site for essential workers, it's eceproviders@wv.gov. Yesterday, on the first day of that program, we received 166 applications. Most of those were from existing child care sites, and we are open to other ones. At this time across the state, there really should not be any child care provided for children other than essential workers, so that we can really maximize the ability of our essential service workers to be cared for, and then to minimize the risk for any other children as well. So that is going to be we ask people to make that shift. In terms of other efforts, clinically, in terms of diagnostic testing, we are working and continue to see expansion of the clinical diagnostic lab system, primarily through our large university major hospitals. So they have really come on board with the ability to do some more rapid turnaround testing, and they've been great partners in much of what we are doing. So that capacity has increased. Our public health lab, we are absolutely really needing to use that to focus on case and contact investigation. We remain in the containment mode and containment phase of this work, in which we are actively following up on individual cases and on outbreaks, and using that public health lab capacity to do that. That supply is very limited still because of the backlogs federally, and we have ordered equipment already a few weeks ago to get the higher technology ones that can be faster and more volume, and we are awaiting those to come in. We are partnering with our university labs to address issues as we need to. And then finally, in investigations, we continue to work on several of those and are onboarding additional workforce and training those folks up, partnership of the Guard and several other entities to really provide support in the regions so they can support local health departments doing this work. So it's active and underway. Thanks.
Thank you, Dr. Slimp. Once again, we're holding today's briefing virtually with media members joining us to practice good social distancing. To ensure all outlets have an opportunity to ask questions, each outlet will be given the floor to ask one question on our first run-through. The order has been selected at random. To media members, when we call on you, please remember to unmute the microphone on your end before asking your question. Today, some media members will be asking their questions through video chat. The first questioner today will be Charles Young with WV News.
Hi, this is Charles Young with WV News. My question is, the state tax department website has not been updated to reflect the announcement that you made yesterday. Could you address that and let us know we'll be getting some additional information on the extended deadline for filing state returns? Thank you.
Brian, you should come up, but if it's not been updated and everything, I don't know why that's not been updated, to tell you the honest truth.
The tax department was working on that today. It's a little complicated with what they got put out, but they've been working on it all morning to get it out today.
Well, my general counsel, Brian Abraham, says they've been working on it all day today, and they're trying to get, they're probably running upon some difficulties and everything. They're trying to get it out, but I wasn't aware of that. It needs to be out. We'll just push as hard as we can. They're working on it.
Okay, thank you, Charles. Up next, Kara Lofton with West Virginia Public Broadcasting.
Hi, Kara Lofton with West Virginia Public Broadcasting.
Yes, we hear you.
No, wait a minute. We don't hear you now. We lost you.
Do you hear me? Sorry.
We got you again.
Okay. Can you talk to me a little bit about what you are doing to, I know we talked about a little bit about this, but I'm getting some emails from people who are really concerned about abuse and neglect cases, especially with kids being out of school and not having the contact with teachers who have been some of the people who keep an eye on at-risk kids. What is being done to protect the at-risk kids in West Virginia?
Well, I understand your concern, and from that standpoint, we're putting more and more emphasis on just exactly what your concern is and everything, especially with our kids being out of school and everything. That can be an issue, but Secretary Krause can probably answer that better than I.
I think that was a pretty good answer. We are putting special emphasis on our children. We're making sure that the individuals that are responsible for following up on complaints of abuse or neglect, that is being done. We're making sure we get personal protective equipment to those individuals. We're looking at things a little differently now in terms of how we do this, but we are definitely focused on that as an area that we need to watch closely while children are home at longer hours. So that is something we're very, very well aware of and putting a lot of emphasis on right now.
Okay, thank you. Up next, David Beard with the Dominion Post.
Hi, I've seen some interest groups today making urging or pushing to consider clearing out some of the jail population to protect their health. Is that of any interest, or have you given that idea any consideration?
Bill, that's you again.
What was the question again? I'm sorry.
Clearing out.
Yes, again, we have communications with DMAPS, Department of Military Affairs and Homeland Security, to make sure that they are doing what needs to be done to keep prisoners separated. That is a congregate grouping of individuals like any group, but we're working hard to make sure with DMAPS that those individuals stay safe and separated as well.
Okay, thank you. Up next, Taylor Stuck with the Herald Dispatch.
Hi, yeah, this is Taylor with the Herald Dispatch. I was wondering, there are some reports coming out about changing symptoms with the coronavirus, so I was wondering if you could talk to about those symptoms, where the state kind of lands with those. Is that going to change testing criteria if more of those come out? That's what I was wondering.
Clay, yeah, Clay.
Governor?
Go, please.
So the symptoms of the novel coronavirus or COVID-19 we're learning a lot about them. So we know, for instance, that the highest infectivity as far as the number of viral particles in your upper airway, which is the main place it starts, is in the first 1 to 3 days of the infection. And that's the time most people are not symptomatic. So it is clear that people can spread the virus before they're symptomatic. Looking at the data from China, it turns out that, at least in one study, about 80% of people were either not symptomatic at all or very minimally symptomatic. So it means that people can walk around with the virus, be able to transmit it, and not know that they have the virus. We know that in studies in Italy that men generally do worse than women with the virus, and at every age group, men died about twice as much as women, and that was also seen in China. In the United States, what we're finding is that as opposed to older people only being affected, and that was really the experience in Asia and even in Italy a bit, that younger people here seem to be getting affected. So 38% of hospitalized people in the United States of America are less than 55 years old, and 20% of people hospitalized in the United States of America are between 20 and 40 years old. And the last thing I'll say is we also now are starting to understand more about the virus. So the virus, if it gets deposited on a countertop or stainless steel refrigerator or piece of plastic or cardboard, kind of goes into hibernation. So the virus can live for a reasonably long time on surfaces, and that means that you really need to pay attention and wash your hands carefully, and don't touch your mouth, don't eat with your hands before you wash. And that's probably the most powerful thing we can do to stop the spread of the virus. Because remember, this virus is everywhere, so we can clean, and that's important. But the key is we want to make sure we don't spread it from person to person so quickly that we overwhelm our health system's ability to deal with that patient surge.
Okay, thank you. Up next, Kenny Bass with WCHS.
Let me, Kenny, hold up for just 1 second. You know, just what Dr. Marsh just said is probably, now we don't know right yet and everything. We're trying to get to the bottom of this and everything, but it is probably what infected us or started this situation in one of our nursing homes. We probably had one of our staff members that was traveling outside the nursing home, doing what you normally would do, and didn't think they were sick in any way, shape, form, or fashion. And forgive me for saying it that way, but really, and they've come, and way before they had gotten sick, and lo and behold, you have what you have. And so we've got to be really, really careful from the standpoint of you can, transmit this disease while you don't feel sick in any way, shape, form, or whatever.
Okay, Kenny, go ahead.
Thank you. This is Kenny Bass with Channel 8 and Fox 11. I want to touch on the website again to Secretary Crouch and perhaps Dr. Slim. And I certainly am not intimating that anyone is not being transparent and that they're not working very hard. But as the governor famously said just earlier, don't mistake effort for achievement. Now, being in the 21st century, people have information systems in their hands. They're constantly hungry for information. Is there a possibility that the DHHR's website is using an outmoded and outdated formula for its updates and only updating one day at a time, one time a day? Every news organization in West Virginia is updating, finding out from county health agencies these updated numbers. What's stopping the DHHR from doing the same thing and applying the same amount of effort? Unfortunately, people are keeping score, and it's important. So why is this thing being updated just once a day? Why is there no change so far? Right now, that information on the website is about 15 hours old.
Yes, Kenny, I think I referred to this yesterday. Let me go into a little more detail. We have a system, and Kathy may be able to talk this a little bit more if you want more detail, but the system is essentially that local health departments, as a part of their investigation of these cases, this is a communicable disease that they are required, that is required to be reported to those local health departments. Once that is reported to the local health department, the next step should be for the individual, the patient, to be notified that they have that disease. And at that point, the local health department can release that information. So We are not always the first one to have that information. It's required to be reported up to the Bureau of Public Health, to Dr. Slimp's office, but there's a time lag there sometimes. So what we are doing beginning, I believe we're going to be able to start this tomorrow, is that we will have a report of those local health departments that publish that information online, and that's generally the only way we can get that at this point. One of the things we don't want to do is contact these local health departments constantly to try to get information, because they're doing investigations and trying to do their job. So whatever's published online, we will 3 times a day provide that information in a report that will be on our website, and I've asked that that be done at 9 a.m., at noon, and at 4 p.m. Later that evening at 8 or 9, whenever the tests are in that are verified and official, we will provide the same official report that we provide every evening. So there'll be 2. One is an unofficial, which is just what the reporters do now, I'm sure, is look at their county, look online, and try to find out what the latest information is. So it's a constantly changing number in terms of those tested, in terms of those positive. We're going to try to help you and be transparent by providing the same information that's available publicly prior to our official report. So, Kathy, you want to comment?
Kenny, the system here is no different than other places. This is how infectious disease reporting works. And so you want the information, the diagnostic information, to initially go back to where the action is. So the first person to receive that should be the submitting provider, the person that can work with that patient. The provider is then responsible for reporting it to the local health department, who then sends it to us. Similarly, we actually work with laboratories. They also have reporting responsibilities under our regulations and code. And so the laboratories report actually directly to us electronically, but not every laboratory can do that yet. So some come faster and some others. We get the positives quickly. We don't always get all the negatives as fast. So at the state level, we are the official count for the state. And then that goes to the federal government so they can track what's happening across the country. So as this goes up, you will see a day or so time lag from local to state, and then from state to federal. So if you go to the federal website and CDC, it says if case counts are discrepant, the state's the most accurate at that moment. This is just a system. It's nothing magic about this. It's no different than any other state.
Okay, thank you, Kenny. Up next, Stephen Allen Adams with Ogden Newspapers.
Hi, Steve Adams, Ogden Newspapers here. I kind of hate to ask this question. I know we're focused on the health and the trying to fight this this coronavirus right now, but I am trying to think ahead. Obviously, the last several months, our state budget has come in as far as tax revenue, about below just around 1%. And I know at one point we were considering mid-year budget cuts, and I know we backed way off that. And I know that we were expecting the next few months to do well, but obviously with payroll due to unemployment, due to coronavirus going down, issues with consumer sales tax, which obviously probably have spiked, but probably won't last too much longer. What are we, and I like I said, I know you probably want to cross this bridge when you get there, but what are we thinking about in regards to the way state budget will be as we get closer to the end of the fiscal year? Have you had any conversations with President Trump or the White House or the federal government in regards to ways for the federal government to try to keep states whole during this crisis? Can you elaborate on any of that?
I can, Stephen, and you're right. We don't need to focus on it from the standpoint of we first and foremost need to protect our people, but we got to focus on everything. I mean, that's just all there is to it, because the economic component of this thing is huge, and so with all that, I have talked to the president about that. And we've had many discussions from the standpoint of different people, whether it be our Secretary Hardy or all of his staff or whatever. But here's what's going to happen. And we're going to probably be, Well, first of all, let me go back to the beginning of your question. The beginning of your question said we were tracking along in a state and at one point in time looking at mid-year budget cuts. And we got way past that without having to do the mid-year budget cuts. And we kept whittling away at our budget deficit and everything and tracking, remember, upon a budget that was a really last year's record surplus year. And so we've got all kinds of major cannonballs and holes that have blown into our budget. But what's going to happen is exactly what happened last night. And with what happened last night, you're going to see the federal government make us whole. And I don't know the specifics yet, but if you were to ask me my opinion would be just this. We're going to be just fine even in the year that we're in. And it may very well be by delaying, the tax deadline until July 15th. We've got to bridge ourselves some way or another from the standpoint of rainy day or whatever it may be. But I am telling you, with the federal government stepping into the level that they're going to step in, I think we're going to be just fine. And that's why I will encourage everybody, all business people and everything else, when the guidelines come out with the House passage, we need to all be working it in every way, shape, form, or fashion to achieve our fair share of the dollars, and any dollars that we can extract and bring to West Virginia, we want to bring them.
Okay, thank you. Up next, Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron from WSAZ. I want to go back to people coming in from out of state who see West Virginia as a possible safe haven right now. I know Yeager Airport has now posted signs and is giving letters asking people who come in from states with a high number of positive cases to self-isolate. And we can say, don't come to West Virginia, don't come to our campgrounds, whether they be public or private. But what teeth do we really have sort of shutting down state borders to require people to make the right decision to self-isolate or to keep West Virginians safe?
Okay. Amanda, all I know is just this, is no state in the nation, I don't think, thus far, has shut down their borders. Again, we've got to understand we're trying with all in us to not set tanks up on all of our bridges and everything to keep people away. But at the same time, we are, as stringently as possible, we are telling people if they come here from out of state, especially if they come here from New York, you've got to quarantine yourself for 14 days, self-quarantine yourself. If we have people that are not doing that, we need to know about it. Because absolutely there's a lot of people out there that can help us to push them to do this. And so granted there's holes in the dike, and what we could do is what our president has even said, we could lock all of us in houses for 2 years, and still at the end of the day, the outcome may not be what we want it to be, but absolutely, none of us would advocate locking us all in houses for 2 years. So we're trying to deal with it as best we can.
Okay, thank you, Amanda. Up next, Brad McElhenney with West Virginia Metro News.
Hi, everyone. What I wonder, I find it challenging to get a real feel for what West Virginia needs in terms of equipment, whether it's respirators or masks. And I wonder if it's possible yet to provide or compile an aggregate estimate of what West Virginia needs for key equipment, and then also a comparison to what is on hand.
Okay, let me try this, because everybody's going to want to answer this, and we'll go on and on and on forever. Let me just keep you at an 80,000 foot level. Here's the deal. Every state in the nation is screaming like crazy trying to get additional supplies. Everybody. Every one of those governors on the call just a little while ago, every single one of them is, I need this, I need this, I need this, can you please do this, can you please do that? Well, what we've done is just this. We've tried to solicit every place on the globe to where we can privately buy whatever we can buy. And then we submit, in addition to that, our order or wish list or whatever to the federal government through FEMA and all those people. And they're working it because that, we're pushing them in every way, saying, that we're the highest risk state. We've got a situation surely in nursing homes. We've got situations all over our state. Absolutely, and we're getting stuff. We're getting supplies. But now, in addition to that, and I've been doing it, I've been doing it, behind the scenes in every way, shape, form, or fashion. But I have now been calling directly to the president and appealing just like I did just a few minutes ago. And I did that directly in the teleconference with all the other governors. I said, Mr. President, this is Big Jim. He said, Big Jim, how you doing and everything? I said, understand, we absolutely have to have these additional supplies. So we've put a big number out there. We absolutely will get some of those supplies from the federal government. General Hoyer will be finding more supplies across the globe, as Kathy and Bill will as well. Clay is an incredible resource, and he's working it. And so the net of the whole thing is everybody's short, everybody's frustrated, but we're going to get our fair share of what we need.
Okay, thank you. Up next, Phil Kabler with the Charleston Gazette-Mail.
Am I on?
Yes, we can hear you.
Hello, everyone.
Hey, Phil.
This is for the governor. Can you update us on the status of any discussions regarding the May primary election, including any discussions of possibly postponing the election date?
Well, Phil, and I've said it over and over. One of the last things in the world we need to worry about is the elections. But we're a society that has elections, and God bless us for it. And so from that standpoint, what I would say is we'll get to it in due time. If we need to extend, we extend. We know the fact that from the standpoint of our poll workers and all that kind of stuff, that it's going to be a possibility of an issue. But when it gets right to crunch time, I don't think, and nor do I think anyone really thinks that if we can avoid extending, we don't need to extend. What we need to do is have people do just what we're doing. Mike Warner's reached out in many, many ways. We're trying to do something, to where people can vote, from absentee ballot or whatever it may be. But we're going to have a free and fair election, and I hope we're going to be able to have it on time.
Okay, thank you. Our last question comes from Aaron Beck with the Register Herald.
Aaron Beck, Register Herald. Can you hear me?
Yes, we can.
Can.
Okay. My question is, yesterday the first case in Raleigh County was reported, which is where my paper is located. And I know you obviously can't give things like names or too personal of information, but I was wondering if you could talk about whether it was community spread, what hospital, what kind of condition that person's in, were they older or younger, if it's related to any Charleston cases, and if there's no one there that can answer that, I'd like to ask a different question.
Let me do a couple of things with this. I can't speak to specific case investigations. What I can say is that happens at the local level, and they find that information out. That is the reason why you do that follow-up of that case investigation. It kind of gets to the data issue previously. So you want at the local level that active case investigation to happen quickly. All you need to start that is a positive individual and contact information. But you don't have all the information at that point. So that is key to the work that is underway. So that's why you're hearing about a case locally, so it could actually start that follow-up. At the state level, we want the collected data that results from that investigation fed into a common system so that we can look at it as a population. We can then say the average age is this. We're seeing it occur in this community. We're seeing this level of criticality of disease. These are the symptoms that we're seeing. That's what takes some time in the investigation that comes to the state level. And so that is when you begin to say, how do we use this data to actually drive action? And so that's the importance of what we collect at the state level. That's why you see a little bit of a time lag here. That's what's important at the state level that we collect. And then that's what we feed into federally, so that federally they can also look at and say what's happening about this disease in the United States and where are different states in their response. So that is the importance of having accurate, full information at the state level. It starts at the local level, but it takes a little bit of time to get there so you can start to look at it. So you need to give that time for that investigation to happen. Locally, they do the investigation, and then they put in place the measures that are applicable in terms of making sure you minimize the spread locally.
That is all the questions we have for today, Governor.
Okay, well, let me just wrap up here, and I'll wrap up real quick, and I'll just say this, that I've told you before, I'm the most impatient guy on the planet. And I really do believe in, I salute everybody for their effort, but at the same time, I believe in don't confuse effort with accomplishment, and what we got to do is accomplish. And I can tell you that, the other day we were basically talking about the possibility of how to keep the Fairmont Hospital open, and it was a little bit confusing because I think one of the questions led to the possibility of the CON situation. From the CON situation, as far as building a new facility, whether it be WVU or Mon Health or whatever like that, that CON situation needs to play itself through because we're 18 to 24 months away from any kind of building, being completed anyway. So that needs to work its way through. However, I said I cannot understand why in the world we can't keep that hospital operational if WVU is willing to move quicker and everything. And I think we've resolved that to where we can absolutely just keep the hospital operational, and provided WVU is moving in that direction. And so we have resolved that, and I think that's going to be placed into the emergency declaration or whatever it may be to be able to accomplish just that. I've talked a lot about supplies, and everyone knows that we're pushing in every way, shape, form, or fashion. I salute everyone here for all the good work they're doing on that, and we need to keep pushing that in every way. On a really almost insignificant point in everything, but Kenny Bass asked me about this, I think a couple days ago. He said there were a lot of people out there that were wondering, if they could go fishing some way without having to, buy a fishing license. And Steve McDaniel was good enough to step up to the plate, and I asked him about it and everything because I thought it was a good idea, and he was good enough to step up to the plate. So we're going to have a grace period of 30 days, and then we may very well have to renew it for another 30 days. And, so if you want to go fishing and everything, now you go, and you don't have to have a license today for 30 days, and enjoy. And the very last comment that I would make is just this, and there's no way around this except one thing. Every last one of us understands wholeheartedly from your governor, and every one of us is doing just this. Everyone run to the fire. Everyone run to the fire. I don't care if it's Secretary Gaunch and Commerce and all the stuff they're doing, or Kathy or Bill or Clay or General Hoyer or myself, we all run to the fire. And so everybody's doing that, and I'm really proud of them all, and I thank you again, and I appreciate everybody out there. Stay the course. Stay away from one another. Listen to everything that's been said to you, because we're making headway, but we're a long ways from being over this. Stay the course. God bless you.